Welcome back to our channel. Today we will be discussing a fascinating topic: can AI be your therapist? In recent years, there has been a surge of interest and research in using AI technology to provide mental health care. AI-powered chatbots and virtual assistants are being developed to listen and offer support to individuals struggling with their mental well-being. These virtual therapists are available 24/7 and can potentially reach a wider population who may not have access to traditional therapy. AI can analyze vast amounts of data from patients to detect patterns and provide personalized treatment plans. Machine learning algorithms allow AI to continuously learn and adapt, improving their ability to understand and respond to human emotions. By mimicking human conversation, AI therapists can provide a non-judgmental and confidential space for individuals to express their feelings. Some studies have shown that people feel more comfortable opening up to AI therapists as compared to human therapists. AI therapists can provide immediate responses, reducing wait times and improving access to mental health care. However, there are concerns about the ethical implications and potential biases in relying solely on AI for mental health treatment. There is a debate on whether AI can truly replace the human aspect of therapy, such as empathy and emotional connection. AI therapists also lack the ability to read non-verbal cues, which are important in understanding a person's emotions. Privacy and data security are significant concerns in using AI technology in mental health care. AI algorithms may not always accurately interpret complex emotions and could potentially provide incorrect or harmful advice. Despite these challenges, AI in mental health care shows great promise and has the potential to complement traditional therapy methods. The future of AI in mental health care lies in finding the right balance between technology and human interaction. Overall, AI can be a valuable tool in expanding access to mental health care, but it should not replace genuine human support and understanding.